curious cats, and welcome back to another episode of the Say Psychology podcast, the podcast for all the info on psychology's most questionable history. I'm your host, Leslie Lopez, PhD student and psychology nerd. Okay, welcome to season 3. How the hell did that happen? It's already been 2 seasons and we've already starting season 3. Insane, and especially with everything going on in life, just feels like one giant roller coaster that you just can't escape, can't get off from, which is ironic because I don't do roller coasters or amusement park rides or amusement park in generals. No, I just don't. Those death traps that they call rides, and then you also have so many people all in one place. It just makes you so claustrophobic, and then you also have the smell of like month-old grease. It just makes me so nauseous. Nope, I don't do it. Just no, not for me. But anyways, once again, welcome to season 3, my curious cats, and I am so excited for what this season holds because we are going to be diving in a little bit deeper into some neuroscience and some neurology all season. That's right, we're going to be looking at some of the most insane experiments ever performed on the human brain and body. We're talking lobotomies, we're talking leeches, we're talking exorcisms. So to all my history nerds out there, this season's especially for you. For our first episode of the season, I thought we'd start from the very beginning with what is considered the very first experiment on the human brain. So if you're a little bit insane in the membrane like me, get cozy tozy and let's jump into it. Do you guys ever have those days where your hair just isn't cooperating? If you're watching on YouTube, you'll see that I started off the episode with like my hair down and now it's in a low messy bun because it's not doing what it's supposed to. Okay, so before we begin our deep dive into the history of brain surgery, I think it's imperative to get a clear understanding of what the study of the brain is in the first place. The study of the brain is called neuroscience. Specifically, neuroscience is the study of how the nervous system develops, its structure, and what it does. Someone who is a neuroscientist focuses on the brain and its impact on behavior and cognitive functions. Now, neurology is a specific branch of medicine that studies and treats disorders of the nervous system. This includes the brain, spinal cord, blood vessels, muscles, and nerves. As we've learned from past episodes, the brain is not one single unit of measure, but rather there are a vast number of connections that stem throughout the human body that make up the human brain. This collection of connections are what we know as the nervous system, a complex system that regulates and coordinates body activities. And the study of neurology involves studying the central, peripheral, and autonomic nervous systems. Finally, we have neurosurgery. This is a type of medical procedure on the nervous system, mainly focusing on the brain and spinal cord. Someone who is a neurosurgeon, aka a brain surgeon, is a specifically trained medical doctor who diagnoses and treats conditions that affect the nervous system, that is, the brain, the spinal cord, and as well as nerve endings. Okay, so the history of neuroscience is actually much older than the history of neurology, believe it or not. Neuroscience has been dated back as far as ancient Egyptian mummification. Early civilizations lacked adequate means to obtain knowledge about the human brain, and their assumptions about the inner workings of the mind were, therefore, not accurate. Early views on the function of the human brain regarded it to be a form of like a cranial stuffing. Like there's just something up there for storage. That's really all it is. In ancient Egypt, when a body was in preparation for mummification, the brain was actually removed from the skull because the ancient Egyptians believed that the heart was the center of all intelligence. In fact, the removal of the brain was the very first step in the process of mummification. The ancient Egyptians made sure the skull was clean as a whistle by extracting as much of the brain as possible with an iron hook. Just went in there and they just like scraped it all out. And whatever little crevices the hook couldn't reach, they cleaned out with a variety of drugs and chemicals. This went on for thousands of years. Slowly, knowledge became more advanced and the view that the heart was the center of the intelligence was reversed, and it is now understood that that is actually the brain. It's actually where we get the saying, "I know it by heart," by the way, which makes complete sense now that I think about it. Neurology, on the other hand, was introduced a lot later. This is because neurology deals a lot with understanding the function of the brain and how those functions translate to human behavior. It's getting a lot closer to psychology and psychiatry, two fields that did not make a proper appearance until centuries after the ancient civilization. In fact, neurology has actually only been around officially for about 200 years. John Martin Charcot, known as the father of neurology, helped to distinguish organic diseases from those of hysteria and other psychiatric origins. Now, stick with me here, okay? Organic conditions can often present symptoms suggestive of a psychiatric disease. However, these symptoms can be attributed to a physical cause rather than a psychiatric cause. For example, symptoms of psychiatric conditions suggestive of an organic cause include history of substance abuse, hallucinations, and poor cognitive functioning. Organic causes include a traumatic head injury, STDs, autoimmune or cardiac problems, etc. These two used to be considered interchangeable until John Martin Charcot began distinguishing the two categories. Sigmund Freud and Joseph Babinski were actually some of his most notable students who continued to go further and separate psychiatry from neurology into distinct fields of study. But that may be for a whole different episode. Now, as for the history of neurosurgery, this is kind of where our episode is focused on. Neurosurgery actually dates back to prehistoric times, although the actual academic disciplines didn't begin until the 16th century. It's no secret that back in ancient times, people were looking for cures in the most creative ways, to say the least. Through archaeology, physics, medicine, and history, we understand that the earliest form of neurosurgery is trepanning, or trepanation. Trepanning is a surgical invention in which a hole is drilled or scraped into the human skull. This drilling of the skull was intended to treat health matters related to intracranial diseases or to release blood buildup as a result from a traumatic head injury. This procedure was done using a trephine. A trephine is an instrument used for cutting out a round piece of skull bone to relieve pressure beneath a surface, in this case, the surface being the skull. Evidence of trepanation has been found in as far back as prehistoric human remains from the Neolithic times. Now, don't be getting the wrong idea, okay? Trepanation wasn't something that was being done left and right, okay? Evidence suggests that it was treated as an emergency surgery for traumatic head wounds to remove shattered bits of bone from a fractured skull and then clean out the inside of the skull that from blood that may have pooled under the skull after a blow to the head, say from a hunting accident or something. One thing to note is that notice how I've mentioned trepanation as a surgery for traumatic injury at least twice now? That's because oftentimes people may get trepanning and lobotomies mixed up. The two do include having a hole drilled into your head. However, lobotomies were meant to treat mental illness, whereas trepanning was meant to treat head injuries. Whether one influenced the other is something to look out for in our next episode. Wink, wink. Okay, quick note/disclaimer before I keep going. Reminder that I am a PhD student. I am about to enter my second year of my doctorate in psychology, okay? I say this because there are a lot of medical terms included in this episode, and honestly, all my information comes from my history of psychology background knowledge, followed by further scholarly research. The only doctor that I aim to be is not the kind that you would want scraping inside your skull, okay? Believe me. Okay, so from as early as the Stone Age to the 19th century, trepanning was widely advocated and practiced for the treatment of head wounds. We got that part, okay? The most common use was in treatment of depressed fractures and penetrating head wounds. A depressed fracture is like a dent in your skull that can be noted through the surface, just kind of flat. Now again, trepanning was not something that was being done just willy-nilly. The doctors performing this procedure were well aware of the extremely high risk factors and the extremely high death rate that came along with it. One of the reasons it was so dangerous of a procedure to perform was that up until the 19th century, trepanning was performed in the comfort of the doctor's homes. It was soon moved to be performed in hospitals, however, which, yay? Question mark? I say question mark because the reality of it is that when the procedure was finally moved to hospitals, the mortality rate was so high that trepanning of any reason, including its main purpose of skull fractures, declined exponentially. It's said that in the later years of the procedure, the first requirement for the operation was that the doctor himself must have fallen on his head. Love that, honestly, like such a serve. Now, although it is clear that the procedure was intended for physical injuries to the skull, there is evidence to suggest that there were a few times in history where trepanning was used to treat mental illness such as epilepsy and madness. This was most common in Europe, however. Trepanning for epilepsy came about as early as the 13th century. Greek clinicians recommended opening the skull of the epileptic to, quote, that the humors and air may go out and evaporate, unquote. Honestly, I don't see how to properly translate that for today's layman. Greek history has always been so fascinating and so confusing, even in their poetry. Like, I've read the Odyssey, but just don't ask me to translate it or tell you what it means. Anyways, the procedure for epilepsy was quickly shut down by the 17th century because it was viewed by the Greeks as too much of an extreme measure. Honestly, good for them. As for the mental illness aspect, for a short time in history, trepanation was seen as a possible cure for mania and madness. According to historians, an incision is made in the top of the head and the cranium is penetrated to permit the mad material to escape the brain. The patient is held in chains because, they're already mad and you're adding the element of drilling a hole into their skull. The patient is held in chains and the wound is treated. By the 18th century, most reputable surgeons had given up the procedure for psychiatric care. They ended up believing that the skull was never to be drilled into for internal disorder of the brain. I mean, certainly a step in the right direction. Also, similarly worth noting, in ancient times, holes were drilled into a person who was behaving in what was considered an abnormal way to then release what people believed were evil spirits. So there was a time when trepanning held a spiritual connection and not just a medical one. By the 20th century, which is the 1900s, by the way, anybody else like that, you hear the 17th century, the 16th century, and you just think like 1700s. Like, no, I always get it confused where it's like 17th century, it's the 1600s, 20th century, the 1900s. I know it's not just me, don't lie. Okay, so by the 20th century, trepanning was no longer considered a valid medical procedure. However, its influence may have stuck around for others to pick up on. And if you guys stick around for the next episode, you'll know what I mean. Well, my curious cats, thank you so much for tuning in to today's episode. Certainly a little different than our past episodes, but if you enjoyed this episode, please remember to like, subscribe, and follow on YouTube, Spotify, and Apple Podcasts. Follow the podcast on Instagram for all episode news and updates at the Say Psychology Podcast, and me, your host, at Se Llama Leslie. As always, citations will be in the description if you want to check those out. Stay blessed, stay sane, and stay psyched. I love you. Bye.